Good evening, medical students. Today, we will embark on a comprehensive exploration of the fascinating world of staphylococcal infections. Staphylococci are bacteria commonly found on the skin and mucous membranes, and they can cause a wide range of diseases in humans. In this lecture, we will delve into the various classifications and virulence factors of staphylococcal infections, as well as their clinical manifestations and treatments. So, let's dive into this captivating topic and deepen our understanding of these intriguing pathogens. Staphylococcal infections are caused by bacteria called Staphylococcus. They can cause mild skin infections or life-threatening conditions. Staphylococci are bacteria that grow in different environments. Understanding their classification is important for diagnosis and treatment. Staphylococcus aureus has various factors that make it harmful, allowing it to cause a range of infections. These include proteins, toxins, and enzymes that help it invade the host, avoid the immune system, and damage tissue. Some notable factors are coagulase and toxins like alpha toxin. The bacterium also has a protein called protein A, which limits the immune response by blocking antibody function. Studying these factors helps us develop better treatments and prevent staphylococcal infections. Staphylococcus epidermidis is a bacterium found on the skin and mucous membranes. It can cause infections in people with weakened immune systems or medical devices. Biofilms formed by S. epidermidis make infections difficult to treat, requiring research on prevention and disruption strategies. Methicillin-resistant Staphylococcus aureus, MRSA, is a strain of bacteria that is resistant to many antibiotics. This makes infections difficult to treat. It's important to understand how it spreads and how to prevent it in healthcare and community settings. Staphylococcal skin infections are common and can vary in severity. Risk factors include poor hygiene and compromised skin. Treatment involves draining abscesses and using antibiotics based on susceptibility. Community-acquired MRSA strains present new challenges. Staphylococcus aureus can cause pneumonia and respiratory infections, with high mortality rates in hospital-acquired cases. Diagnosis relies on clinical, radiological, and microbiological findings. Treatment involves antibiotics and support for respiratory distress. Staphylococcal endocarditis is a potentially life-threatening infection involving the inner lining of the heart valves. It typically occurs in individuals with pre-existing heart valve abnormalities, intravenous drug users, or those with prosthetic heart valves. Staphylococcus aureus is the leading cause of infective endocarditis, particularly MRSA strains. Treatment of staphylococcal endocarditis involves a prolonged course of intravenous antibiotics, often guided by antimicrobial susceptibility testing. Valve replacement surgery may be required in certain cases to remove the infected tissue and restore normal cardiac function. Staphylococcal osteomyelitis is a bone infection caused by S. aureus. It can cause localized pain, swelling, and restricted joint movement. Diagnosis includes clinical presentation, imaging studies, and microbiological culture. Treatment involves antibiotics and surgical debridement if necessary. Staphylococcal toxic shock syndrome, TSS, is a rare but severe illness caused by certain strains of S. aureus that produce toxic shock syndrome toxin 1, TSST1, or enterotoxins. TSS is characterized by the sudden onset of high fever, rash, hypotension, multi-organ dysfunction, and desquamation of the skin. Prompt recognition and treatment of staphylococcal TSS are critical, as it can rapidly progress and lead to life-threatening complications. Treatment involves aggressive fluid resuscitation, antibiotics targeting MRSA, and supportive care in an intensive care setting. Staphylococcal food poisoning is one of the most common foodborne illnesses worldwide and is caused by the ingestion of preformed staphylococcal enterotoxins present in contaminated food. Food items such as dairy products, meat, and salads are commonly implicated. Symptoms of staphylococcal food poisoning typically develop within a few hours of ingesting contaminated food and include nausea, vomiting, abdominal cramps, and diarrhea. The illness is self-limiting and usually resolves within 24 to 48 hours. Prevention involves proper food handling, refrigeration, and avoiding cross-contamination. Staphylococcal septicemia and bloodstream infections can arise from various sources, such as skin and soft tissue infections, intravascular catheters, or surgical site infections. Staphylococcal bacteremia can lead to severe complications, including infective endocarditis, osteomyelitis, and septic emboli in distant organs. Diagnosis relies on blood culture samples, which are essential for determining the causative microorganism and its antimicrobial susceptibility. Prompt initiation of appropriate antibiotic therapy, guided by culture results, is crucial to improve patient outcomes. The emergence and spread of antibiotic-resistant staphylococci, particularly MRSA, have posed challenges in the treatment of staphylococcal infections. MRSA strains are resistant to multiple classes of antibiotics, limiting treatment options and leading to increased morbidity and mortality. Researchers continue to search for novel treatment modalities to combat staphylococcal infections. This includes the development of new antibiotics, exploring the use of bacteriophages, immunotherapy, and targeted therapies that aim to disrupt key virulence factors or biofilm formation. Staphylococcal infections are complex diseases caused by Staphylococcus bacteria. It is important for healthcare professionals to understand their classifications, symptoms, and treatment strategies to provide quality care. Stay updated on diagnostic techniques, therapy, and infection control. Thank you for watching.